One of the discussions that we always talked about our patients and families with, whether they were on palliative or hospice care, we always talked to them about their goals of care and identifying those and how we incorporate those into the medical plan and medical decision making. And it's critical to have these now with your loved ones, especially, and with your healthcare providers, especially, especially if you're dealing with any kind of acute or chronic conditions. Hi, my name is Abigail. I'm here to normalize conversations and education about death and dying so we all die better at end of life. Let's get into it today. So, goals of care. Why am I even bringing this up? And, especially if you're just having a regular day and, things are kind of normal for you. It's important to talk about your goals of care with a few different people. Primarily, it's important to get this straight in your own head and in your own being about what you want at end of life. And secondly, and thirdly, it's critical that you talk to your loved ones, these people who are going to be making loved ones and or designated decision makers who will be making the medical decisions on your behalf should you become incapacitated, not able to make medical decisions for yourself. And lastly, it's extremely important that you talk to your healthcare providers, your medical providers, because they need to understand and know. And not only to talk to them, but once you get your paperwork together and all of those, the appropriate things documented, your revocable trust, your wills, your DPOA for healthcare assigned, all that type of stuff. Once you get all that paperwork done and assigned, it's really critical that you also have these discussions first and foremost. Now, if you don't have your paperwork done, start having those discussions now and get that paperwork done, as soon as possible. Especially if you have no designated decision makers, especially if you have, children or, parents, and really, can't think of a reason not to. So we're going to talk about that today. So how do we actually even go about doing this? So first things first, especially if you are have been diagnosed with any type of condition, it's critical that you understand what your condition is, what other additional conditions that you have, how that plays into it in terms of your timeline. And I'm not just talking about your timeline until death. I'm talking about your timeline and how it impacts your quality of life. So with your diagnosis or diagnoses, how are these things impacting day to day over time? A month out, 6 months out, a year out, whatever it may be. And titrate this, of course, modify this according to, your age, the life expectancy, all this type of stuff, all very, very important. And not just what is expected over life expectancy, but what kind of things can happen from an acute standpoint and a chronic standpoint. So what can happen, should there be some acute event, whether it's something related to your illness, your condition, or something that is not related, some other unexpected acute event, such as a car accident. How does it impact you overall and this diagnosis and these diagnoses overall? What does that look like? A fall, some other traumatic type of event, anything like that, how does it impact it? And what's really critical is that you have these discussions with your medical providers and you really understand what it looks like. You need to really insist on your medical providers to be detailed in what does this look like for me? How does this impact my day-to-day? And what does your day-to-day look like right now? And how is it actually impacted from the time you get up to the time you go to bed and you're sleeping? How is it actually impacting every single hour that you're awake? Because we don't really realize it. I know this sounds kind of obvious, but we don't realize when something is altered until the time that it's altered. So we don't realize how easy it is for us to say, get up out of bed and go brush our teeth and urinate without any assistance until we lose the ability to do so. It's a very, very different thing, like say maybe, if you've ever experienced, if you're healthy now, maybe you've experienced, pulling or straining your back, for example, and then all of a sudden you realize, oh, I can't even move without feeling immense pain or pain shooting down my leg, or I can't even, when I hurt my back years ago, I had to crawl around my apartment for 2 weeks. It was just devastating for me, because I couldn't even stand up straight. It was awful. So, any of those things, how does it actually impact me and impact that quality of life? So it's very, very critical. Now, when we're talking about things like quality of life, what I really want you to think about is, first of all, what is most important to you? Whether it's you who is dealing with a condition, that is impacting your health, or if you're a family member, how is this impacting your quality of life? What does quality of life, what does that term actually mean to you? And I want you to think about day-to-day tasks and activities specific. And again, making sure that you understand what those details look like. How do you want your day-to-day life to look? And, is what you're doing, with your medical care, is that congruent to how you want your day-to-day life to look? And what I like to do is I like to go through certain types of sections or, kind of parts to us. So one example may be, let's look at several types of aspects of day-to-day life. Number one, mobility. What kind of things are acceptable? Is it acceptable for you to walk completely without difficulty, or a family member to walk without difficulty? Is it acceptable to walk with some kind of assistance like a cane, a walker, or is it acceptable to be in a wheelchair? Is it acceptable to be in a wheelchair, with someone pushing you around, or do you want to do it independently? Or is it acceptable for you to be in bed? What kinds of things are acceptable? That's for mobility. Routine activities is another aspect of day-to-day. What is acceptable for routine activities? Is it to be able to work or volunteer inside or outside of the home? Is it being able to still do housework, hobbies, even though you can't go to work or volunteer? Is it being able to, even though maybe you don't want to do those, or that's not acceptable? Is it able to do things like reading and watch TV or use your computer? Or maybe it's not doing any activity, maybe that's acceptable to you. And again, it depends on, the person and their stage. Another aspect of day-to-day is self-care. What is acceptable? Is it acceptable for you to be completely independent in your care? Or are you accepting of having some kind of assistance, say with cooking, or maybe you're living independently, but maybe you're getting help, you're getting Meals on Wheels, or maybe you are living in an assisted living facility because you have additional support there and you're able to financially afford it, and somebody's helping you, coming in once a day and helping you with your bathing, for example. Other aspects of day-to-day are our level of consciousness. Is it acceptable to, are you insistent upon, wanting to think clearly and doing everything you can to continue to think clearly and cognitively and manage your own life? Or is it acceptable to manage some parts of your life and some other parts of it, having some kind of assistance? Or, what is it going to look like? Are you going to be, with your decline, are you going to be confused? And is it acceptable for you to be sustained in a very confused, mildly or very confused state, or not being, aware of anything that's going on? Is it acceptable, say if you have a stroke, is it acceptable for you to be completely unaware in your surroundings and being kept alive with some tube feeding, even though you can't make sense of your environment? What is acceptable for you there? And another thing in terms of, day-to-day is level of communication. So what is acceptable for you in terms of level of communication? Is it acceptable to talk without difficulty? Is it acceptable for you to maybe, if something were to happen and you had some level of difficulty with speaking, but you could still communicate through writing and still understand most things, is that acceptable to you? Or are you acceptable with even less than that? And it's important to look at all of these things and to think about what is actually acceptable to me, and in a situation where I can say, at this point where I reach this time of things that are not acceptable to me, I really make sure that we allow things to take a different direction in terms of my medical care. So that's the whole point of going through that. I just wanted you to go through that without any kind of, without making you think about, what the next steps are. I just wanted you to think about what was acceptable or not. And so it's important to really look at those little details. And we're not even going into as much detail as possible. But, I really want you to think about, what does it look like from the time you wake up? And, what is acceptable to you? Is it acceptable for someone to come in and change your brief because you're incontinent, and doing that day to day and keeping you alive and sustained in that state, for as long as possible? Is that acceptable? Or if you reach that point where you can no longer toilet yourself and you're not aware of what's going on in your environment, then if that's determined by you to be unacceptable, in an unacceptable state that you want to actually, you don't want to prolong, then okay, I really want at this point to really change the direction and goals of my care, and, really make sure we bring hospice in. We focus solely on comfort and do nothing more to artificially prolong my life. I want to allow for my natural progression of death to occur, keep me comfortable, and allow me to, die as naturally as possible while being very comfortable and managed by a good hospice team. So critical to think about this in terms of goals of care. And clinicians or non-clinicians out there, these are critical things and critical details to cover at any point, especially if you're talking about, any kind of active diagnosis or other diagnoses, whether it's acute or chronic. Especially when we're talking about people who are, older, of age of, that's considered geriatric, or someone who is already seriously ill. You absolutely must have these discussions. So really getting this clear goal of care and goals of care in your mind is critical in terms of how you're going to go about your medical decision making. So I wanted to go over those aspects of, day to day, because again, it's critical for you to understand what you're accepting of and what you're not accepting of. And whenever you make that switch, you need to make sure that it's really clear to you, really clear to your loved ones, your decision makers, your medical practitioners, to understand that at this point, I want to redirect my goals of care from, curative to comfort care / hospice, and really make sure that I'm allowed to not have any more prolonging curative type of measures done. I really just want to allow the natural progression of my disease to move forward so that I can be as comfortable as possible, because I don't want to be in a state where I can't communicate, where I can't eat on my own. That's just personally, not what's right for me. I'm just giving you an example there. You need to decide what's right for you. Some people, believe it or not, some people are watching this and are like, yeah, well, obviously I don't want to be like that. There are some people where, we kind of assume maybe quality over quantity, but there are people that quantity over quality is important to them. For them, being alive, regardless of what state they're in, it's more important for them to be alive longer than, their quality. So we can never sit and assume that somebody is going to choose quality over quantity. We can never stay and assume that. And don't judge people for that, please. It's to each and every one their own. But I do want to say that if we're really talking about quality of life and goals of care, let's really start having these discussions now, so at least we're making the most informed decisions, because that is the whole point here, is to make the most informed decisions so that at the end of life, you die a better death. That's the whole point here. Let me know if you have questions. Let me know if anything, wasn't clear enough, if I need to expand on certain areas. I'm happy to do that. We've got the capability here, and I will do this for you. So you tell me, if you write me back, if something wasn't clear, if you want me to go deeper into any of these things, I will do that. And will read every single comment, respond to you. And if it needs to be another video, I am more than happy to do that. So just let me know what you need. I am here. I'm Abigail, here to ensure that we are normalizing these conversations and education about death and dying, so we all die better at the end of life. Thank you so much for tuning in. I will see you soon.